Greetings from Heart Care Foundation of India and eMedi News. The topic for today is persistent acidity. Persistent acidity can cause cancer in long run through a condition called Barrett's esophagus. Acidity is acid peptic disease. It can be either increased production of acid in the stomach, or it can be a reflex of acid into the food pipe called esophagus. Normally, acidity would start in young age. If a person gets an attack of acidity for the first time in life at the age of 40 or above, one should first rule out heart attack or coronary artery disease or angina, as acidity may be a presentation of heart ischemia or lack of blood supply to the heart. Previously, we used to say acidity is due to hurry, worry and curry. Therefore, reduce intake of curry, which in Ayurveda means pungent, sour and salt. That means pepper, whether it is black pepper, red pepper or green pepper, should be reduced. Sour and fermented food should be reduced. Salt should be reduced. Anything which is warm or boiled or hot should be reduced. Apart from that, allopathically it has been seen that all those drugs and food items which relax the sphincter of esophagus should be reduced in diet. And they include fatty foods, peppermint, chocolate, excessive intake of alcohol and drugs like nitrates. Therefore, people with acidity should avoid eating both chocolate and peppermint. Peppermint may be present in the pan which they eat after eating food, and that should be avoided because that can precipitate an attack of acidity. Also, people who have acidity should be sleeping in such a way that the head end of their bed is raised by it can be a wooden block or a brick, so that they don't get regurgitation in the stomach, in the esophagus. Persistent acidity also can cause regurgitation of acid in the voice box, leading to chronic laryngitis, or it can also go to the respiratory tract and cause nighttime asthma. So beware of acidity. It is curable, it is preventable, but don't ignore it. Thank you.